All right, let's move along to the soft tissue structures of the shoulder. So, the really important thing to understand with muscular wise, there's a lot of muscles that act on the shoulder girdle, but the rotator cuff are the muscles that are responsible for internally and externally rotating the shoulder and also abducting and flexing that shoulder in a very functional position. So, the functional overhead motions of throwing or in volleyball or tennis, anything that's overhead swimming. Is really going to come from that rotator cuff. So understanding where they're positioned and how they act on the humeral head is very important and in this class, and you will be tested on that. So we have the sits muscles. That's how we remember them. SITS, supraspinatus, infraspinatus, teres minor, and subscapularis. So when you look on the posterior side, if you're ever trying to wonder where they're located, listen to what the term is and where it's telling you where it's located. So supraspinatus means supra, above the spine. It's referring to the spine of the scapula. So you look on the back of the scapula and you have this ridge that comes out to create the acromion. You have the supraspinatus here, the infraspinatus beneath it, and the teres minor beneath that. And then subscapularis is underneath the scapula. So right in front of that will be the thoracic rib cage. So you would never see this. It's between your scapula and your rib cage. So when you think about where these are positioned and where they're attaching, so the supraspinatus, infraspinatus, and teres minor are all attaching to the greater tubercle on the outside of this humeral head, where the infraspinatus, the subscapularis is going to attach on the lesser tuberosity right here on the anterior part of the humeral head. So let's start with the subscapularis, with it coming underneath and attaching to the anterior humeral head. When it tightens, it's going to rotate this do internal rotation. So this way. So if you're looking at my shoulder, it's going to internally really basically if you take your arm and you really crank, that's internal rotation. Versus the teres minor and the infraspinatus, they're going to attach on this outer part and come around the back of the shoulder girdle. So when they tighten, they're going to externally rotate the shoulder. So they're really going to externally rotate. So that movement here on the head is really going outward. And then the supraspinatus is arguably the most important muscle and the muscle we talk about the most, especially when it comes to injuries, because it's coming over the top of our shoulder and through this tiny little narrow area. And I'll talk about that in pathomechanics and biomechanics for subacromial impingement. But it attaches on the top here, and it's going to abduct and flex our arm. And it's going to do it in this plane of scaption. So flexion is right in front, abduction is to the side. We're going to go right in the middle at 90 degrees, and this is the plane of scaption. It's 45 degrees in between flexion and abduction, and this is where the subscapularis is the strongest, and this is a very functional motion. So the rotator cuff is really responsible for the rotating externally, internally, and also flexing and abducting. So all in that functional plane of motion. So then moving on, we also have this long head of the biceps. As you can see, I'm going to talk about this in the next section because it runs right underneath that subscapularis or the supraspinatus, and it runs right through this groove, this bicipital groove, and down the front of the arm. It really can act as a supraspinatus when the supraspinatus is not acting the way that it should, or if it's weak or injured, and it can create a lot of inflammation in this narrow little area. So it's important to understand that this long head also runs up and it attaches within the labrum to the glenoid. So to the actual fossa, there's a supraglenoid tubercle there that it attaches to, but it's attaching through the labrum. So it has a lot of impact on the labrum and how labrum injuries happen on that superior part of the labrum. So we'll talk about that in the next section as well. In addition to the muscles, what's invisible on this model are ligaments. So we have these ligaments, the glenohumeral ligaments. You have the superior, the middle, and the inferior ligaments that act as a bag, and it basically supports against any kind of anterior stress. So they're not very strong and they can be easily ruptured when there's a lot of force. So for dislocations, we'll talk about that in key injury spotlight, but they do sit like this. Posteriorly, the shoulder is really protected by the rotator cuff and the scapula. And then anteriorly, they have all of these AC ligaments. So you have two ligaments that attach here that hold down the AC right here. You have these two and you have this one. And then you have what these are considered syndesmosis ligaments that are holding the coracoid process to this clavicle. So it is important to understand this coracoid process comes out from in front of the glenoid, and that's an attachment point for the AC ligaments, the pec minor, and the coracobrachialis, and also the short head of the biceps. So it's an important part as well to understand for attachment wise purposes. So basically, the shoulder is reinforced by some bony stabilization in those ligaments, but mainly the shoulder muscles and that rotator cuff being really important. So make sure you understand the sits muscles of the rotator cuff and what directions they're pulling in. You will be assessed on that on the quiz, and if not on the quiz, on the exam. Reach out if you have questions.